What are let's begin with what are the deformities of skeleton? Human skeleton supports an upright body. Sometimes a skeletal system becomes weak and results in deformations. The cause of deformation are variable. For example, number one, genetic causes. Cleft palate, a condition in which palatine processes, maxilla and palatine bone fail to fuse. The persistent opening between the oral and nasal cavity interferes with sucking. It can lead to inhalation of food into the lungs, causing aspiration pneumonia. Microcephaly, the small cell size skull, is caused by some genetic defect. Arthritis crosses over 100 different types of inflammatory or degenerative diseases that damage the joints. Osteoarthritis is most common. Chronic arthritis, which is a degenerative disease, also caused by genetic defect. Number two, hormonal causes. Osteoporosis is a group of diseases in which bone resorption outpaces bone deposit. In this case, bone mass is reduced and chemical composition of the matrix remains normal. Osteoporosis mostly occurs in aged women, which is related to decreased estrogen level. Other factors which may contribute include insufficient exercise, diet, poor in calcium and protein, and smoking, etc. Estrogen replacement therapy offers the best protection against osteoporotic bone fractures. Number 3. Nutritional causes. Osteomalacia, soft bones includes a number of disorders in which the bones receive inadequate minerals. In this disease, calcium salts are not deposited and hence once one soften and weaken. Weight-bearing bones of legs and pelvis bend and deform. The main symptom is the pain when weight is put on affected bones. Rickets. It is another disease in children with bowed legs and deformed pelvis. It is caused by the deficiency of calcium in diet or vitamin D deficiency. It is treated by vitamin D fortified milk and exposing skin to sunlight. Disc slip. Each invertebral disc is a cushion, like pad, composed of an inner semi-fluid nucleus pulposus, which acts as a rubber ball to give a disc its elasticity and compressibility, and a strong outer ring of fibrocartilage, the annulus fibrosus. The annulus fibrosus holds together successive vertebrae. The disc act as a shock absorber during walking, jumping, running, and to lesser extent bend laterally. Severe or sudden physical trauma to spines, for example from bending forward while lifting a heavy weight object, may result in herniation of one or more discs. The herniated disc, commonly known slip disc, usually involves rupture of annulus fibrosus followed by protrusion of spongy nucleus pulposus. If protrusion presses on spinal cord or on spinal nerves, exiting from spinal cord generates severe pain or even destruction of these network structures. Disc clip is treated with bed rest, traction, and painkiller. If this fails, disc may be removed surgically. Spondylitis, it is a disease which causes immobility and fusion of vertebral joint. Sciatica. It is characterized by stabbing pain radiating over the course of sciatic nerve and results due to injury of proximal sciatic nerve, which might follow a fall, a herniated disc, or improper administration of an injection into the buttock. This may result in a number of lower limb impairment depending upon the precise nerve root injured. When sciatic nerve is completely transected, the legs become nearly useless and cannot be flexed. All foot ankle movement is lost. Recovery from sciatic injury is usually slow and incomplete. Arthritis, an inflammatory or degenerative disease, damages joints. It results in pain, stiffness, and swelling of joint. Acute forms of arthritis result from bacterial invasion and are treated with antibiotics. Membrane lining the joint thickens, fluid production is decreased, which consequently leads to increased friction. Chronic arthritis includes osteoarthritis, rheumatoid arthritis, and gouty arthritis.